Well, welcome. I'm Shirley Fenton, manager of the InfoNet project and also managing director of the Waterloo Institute for Health Informatics Research. And I welcome you today to our first seminar of 2005, which continues the series in Health Informatics Tools for the Future. As well as people attending in the audience today, we are also welcoming people that are coming in via our live webcast. So welcome to those people as well. And just to note that whether you attend in person or come in through the live webcast, we will, for this presentation and future presentations, have them available on our archive. So that's available 24/7. So please feel free to browse our archive of these presentations as well. Special welcome to our speaker, Bill Hersh from Oregon Health and Science University. I'll introduce Bill in a minute. Before we begin, however, I just want to have a minute or so just to tell you about some of our future events. Our next seminar is on February 23rd. John Glasser of Partners Healthcare will be our speaker. And as well, we're hosting a very special event on March the 10th. This is a Health Informatics and Bioengineering Career Evening. We're inviting students, industry, and health care organizations to come and join us on that date, 4:30 to 7 at this location. And we'll have a very nice time for presentations and interactions between students and healthcare and industry partners. And lastly, a special thank you to our seminar sponsors, McKesson, BON Canada, and Healthcare Information Management and Communications Canada. So thank you very much for helping us put on this seminar today. With regard to our seminar series, we've had the very good privilege of having wonderful speakers. And we're pleased to have with us today Dr. Bill Hersh. Bill is a professor and chair of the Department of Medical Informatics and Clinical Epidemiology in the School of Medicine at Oregon Health and Science University and hails from Portland, Oregon. He's one of the leading experts in biomedical information retrieval, and he's also known for his development of educational programs in biomedical informatics. Now, yesterday, I encountered a whole new meaning of doing things on the fly. I asked Bill for his presentation by yesterday so that we could have it for the webcast today. And indeed, he did. He sent it to me while flying to Toronto while he was at the Chicago airport. So I guess that is a new meaning for on the fly. So with that, please welcome Bill Hersh.
Well, thank you all for having me here, and thank you to Dominic if you're out in internet land somewhere. And I appreciate being able to talk. I'm quite familiar with the University of Waterloo, both the Health Informatics program and my information retrieval colleagues, who actually hail from the two different worlds in which I live. So when Dominic and I were trying to come up with the topic, I actually deal with a lot of issues broadly in medical informatics, but we decided probably best to focus in on my more kind of narrow area of research, which is information retrieval. And a few years ago was asked to give a talk on the grand challenges coming into the 21st century. I guess we're 5 years into it now. But I use this opportunity to update this talk and present it to you. If you're real familiar with information retrieval, we might only scratch the surface on a few things, but I hope I can kind of convey what some of the big issues are in information retrieval when it's applied in biomedicine. This slide showed up on the web a few days after some event in November, and I hail from one of those blue states, and without getting into too much politics, we were a little blue about the outcome, but I guess now I'm actually part of Canada, so greetings from Portland, Canada. Anyways, actually, I can't remember who either sent this to me or I sent it to, but it was flying around a lot by email and so forth sometime around early November. So what I'm going to talk about is first just give a little primer on information retrieval for those of you who might not be real familiar with the field, although the odds are that probably everyone in this room does information retrieval. Just going to talk about a few of what I consider to be the non-grand challenges, although they're still important. And then we'll list some of the grand challenges and focus in on a couple of them. In an hour's talk, I can't quite cover all of what I would consider to be the grand challenges, and then have some final thoughts. So I guess a little commercial here. If you're really interested in this topic, I've written a book on it. But let me just tell you a little bit about what information retrieval is, at least as it's historically been applied. It mostly focuses on indexing and retrieval of what we sometimes call knowledge-based information, particularly in fields like medicine, the knowledge base of medicine as opposed to things like patient records. And it's historically been associated with document retrieval, and in particularly focusing on text. Although we live in an increasing multimedia world, and many of the people who started their careers dealing with text retrieval and so forth are now doing things like image retrieval, video retrieval, and so forth. So it's broadened. And to put this into a little bit of a clinical perspective, one way that I like to kind of categorize the information in clinical medicine is to look at the two broad categories of information and what people do with it. So typically a healthcare provider is concerned with patient-specific information, so that's information that gets generated in the care of patients. And these are things like electronic health records, telemedicine. I know you do those things here. It's really used more to kind of report what happens to people, to document and so forth, anticipate problems in the future. And then that's as opposed to knowledge-based information, which is the scientific foundation of healthcare. And information retrieval systems actually fit into that category. Evidence-based medicine, the idea of seeking and using the best evidence to make clinical decisions, would also fit under that area. Brian Haynes, who works on the other side of Toronto at McMaster University, which is really where the evidence-based medicine movement began, talks about a hierarchy of information. And this hierarchy is kind of developed from the standpoint of a clinician needing information, but it really can apply broadly to many areas. So at least when we're dealing with scientific information, and it can be computer science and any other type of science. At the foundation, you have how information is discovered, the original scientific studies. Those are typically published in journals. Oftentimes, both people inside a field and those outside of it or coming into it are interested in syntheses of information. In a particular type of synthesis of information in medicine is called a systematic review, or also called an evidence report, where people literally do the complete finding everything on a topic, picking out deciding what are the most important studies. Sometimes you use techniques like meta-analysis and so forth. Even these syntheses can be pretty long, and a lot of times what people really need is a synopsis. Particularly a busy healthcare practitioner who, when they want to know about the efficacy of a drug or a diagnostic test, don't have time to really even read a long synthesis, let alone go get the original study. So synopses are actually very popular, always have been in medicine and in many other areas. A lot of times on the web, we want to find a small piece of information. The next step up, Haynes actually talks about systems and computer-based decision support. You can almost kind of throw something like the semantic web or systems like that up here that start to structure out the knowledge and use it in decision support. And so information retrieval kind of focuses on retrieving the appropriate kinds of information in these different levels of the hierarchy. Now, I've been working, as a number of people in this room have, in information retrieval for a long time, you know, at a time when the only physicians who used information retrieval were, you know, called early adopters, and no one could even fathom the notion that your children or your grandparents or whoever would be searching the medical literature online for information. So the world has changed a lot. Certainly people are doing a lot of searching. It's real popular, and actually you folks hosted the SIG-IR 2003 meeting and know where I got these T-shirts. But in any case, you know, my kids both actually have Google as their homepage when they open up their browser, and you know, so you contrast that with the world of 10 or 15 years ago, where, you know, no one really did any, or you know, maybe librarians were the only ones who did online searching, and now everyone is doing it. But of course, we've run into a few new problems along the way. This is also pertinent to those of you who may have teenagers and so forth. You know, the best minds, people in universities, whatever, are producing all this great technology and great knowledge and so forth. But then what do you really find on the internet? You know, and when your homepage gets hijacked and you know, spam and all that stuff. So there's certainly no lack of new challenges. So in the simplest sense, the idea behind an information retrieval system is that your goal is to find content. It can be documents, it can be web pages, journal articles, images, etc. And the user puts in queries. So find me information about so and so forth. And the way that we hook up queries and content is we generate metadata. So data about the content that's expressed in a way that the user can put a query in that metadata and get what they're looking for. So the process of extracting content, whether it's done by a person or a machine, to get the metadata is called indexing, and the process of putting those queries in to run against the metadata to get documents back is called retrieval, and the software system that actually does that process is commonly called a search engine. So these are some basic information retrieval terms that you hear. So the two intellectual tasks of information retrieval are indexing and retrieval. And indexing is the assigning of that metadata to content items. And there's various ways to do it. You can either assign terms, so what this content is about, and there are ways to do it with individual words, and that's typically done at a computer level. Google and everyone else that crunches through all those web pages, pulling out words and so forth. Or you can have a human indexing process like the National Library of Medicine uses for Medline, the bibliographic database, and the MESH terms, medical subject heading terms, are assigned, a controlled vocabulary. There's also other kinds of metadata attributes that are very important, particularly in things like biomedical searching. Sometimes we want to search on an author. Sometimes we want to search on a certain source. We may want to limit, not search over the entire biomedical literature, but a few journals and so forth. Or increasingly, particularly like in clinical medicine, we want a publication of a certain type. So we don't just want articles about diabetes. We want a clinical practice guideline about diabetes. Or if we're interested in a certain treatment in a certain disease, we don't want any articles. We want reports of randomized controlled trials, things like that. So that's the indexing process. Even when it's done by a machine, there's some intelligence behind it because someone's had to write a computer program to do that machine indexing. So the other side is retrieval, and I'm sure most, if not all of you in the room have done it and probably know about the different types. But essentially the most common types are Boolean searching, where you specify your metadata items, whether they're words, controlled vocabulary terms, or other attributes, connected by Boolean logic and or not, or the approach that has been around actually for about 40 years but has only recently kind of come to the mainstream, which is natural language searching, which is the ability to enter a bunch of words and to not have to hook up Boolean operators, even though everything is sort of an implicit either or and, depending on how the search engine is set up. And then the output, and actually you can do ranking with Boolean systems, but it's typically not done. But the natural language systems tend to do that, and there's different ways to rank the output. Historically, you would do things like word frequencies and so forth, and output them that way, although Google has popularized the link frequency, so how often other pages link to a page. And I'm sure you all know that's how Google does it very successfully on the web. The academic information retrieval community has always been very concerned with evaluation, seeing how well the different approaches work. And even the industry is concerned about it too, because naturally they want to make sure that their information retrieval systems that they're building work. There's a whole massive literature on evaluation of retrieval systems and how to do it. You can segregate the approaches into those that focus on the system, so the computer system, the algorithms, and so forth, and those that focus on the user. And there's a little tension between the two, because anytime you put a person down in front of a machine, you can't always predict how they'll do. And so something that may work very good at the system level, the user may not be interested in using that feature, or the user might use it in a way that negates its benefit. The system-oriented approaches have historically focused on what are called relevance-based measures. So how many relevant articles or documents you retrieve. And the two measures of recall and precision, which for those of you who are familiar with medical diagnostic test evaluation, are equivalent to sensitivity and positive predictive value. But recall is the proportion of all the relevant articles out there that you manage to get back. And there's ways in which you can measure that and create test collections that allow testing of it. And then precision is of the articles you actually retrieve, what proportion of those are relevant. There tends to be a trade-off between the two, although it's not an automatic mathematical thing. But in general, if you phrase a search really broadly to get high recall, you'll probably have a lower precision, versus if you narrow your search, you will probably get a good precision, but you may miss a lot of things and have a lower recall. And then there's all kinds of different measures that have been proposed to combine these two. Everyone wants a single number to see how well a system does. And mean average precision has emerged as this number, although it doesn't necessarily correspond to something you can think of conceptually as a searcher. But it's basically every time for an individual query, the average precision is what the recall is what the precision is at each time you get a new relevant document. You average that, and then the mean average precision is over all of the searches that you do. And it gives you a number that you can compare systems, although it's unclear the meaning of a difference and so forth. Many people, myself included, have done a lot of studies looking at how real users actually use these systems. And there's a variety of things you can do. You can always measure things like user satisfaction, although that doesn't necessarily tell you they did well. They think they did well. One line of work that I've done a fair amount in is the ability to complete tasks. You give people some tasks to do, such as answering a medical question, and you see how well they do with different kinds of systems and how long they take and so forth. And then probably the ultimate measure is, does the retrieval system help someone, either do their research more efficiently or take better care of a patient? It's hard to do those kinds of studies because the information retrieval system may only be peripherally related to the ultimate outcome that you're interested in, but it's something you could look at. So I said I was going to mention some non-grand challenges first. I don't mean to belittle these problems, and I don't even mean to belittle the research around these problems. I mean, I do some of the research around these problems, but they're problems we have a relatively good handle on, and there's certainly more work to be done. But you know, things like using an IR system to, quote, find some information, you know, so going up to Google or Medline or whatever, and you know, typing in a few words, and it works surprisingly well. And you know, in hospital settings and so forth, when people need to find information, they can find some information, not necessarily the best, not necessarily, you know, what's going to be completely useful, but people can find things. And then finding a known item, and probably like many of you, I have my Google toolbar there, and a lot of times I'm searching for a specific known item, some web page or document or whatever. So obviously we still need to learn more about these kinds of challenges, but they're, I don't know that I would call them the grand challenges. And there's a role for librarians and informaticians, computer scientists, et cetera. So for the grand challenges, I will, I mentioned I was going to talk about two, which is some of the challenges for one particular class of users, which is biomedical researchers. And I'm going to talk about some research that I'm doing now that is particularly interesting to me anyways. And then this whole notion of open access, which is important for people who are researchers, for people who are healthcare IT people, for people who are consumers of medical information, and so forth. There are lots of other interesting grand challenges, but you know, in a one-hour talk, it's hard to cover them all. But the other classes of users, clinicians, patients and consumers, becoming an important area. The whole issue of metadata, of content on the web, and you know, there's so much of it, it can't all possibly be done manually. How do you do it semi-automatically or completely automatically? Work on continuing to build better measures for evaluation and do more meaningful studies. And then the whole area that some of you may know about, and I've had some students who've done work in it, of how do people evaluate the quality of health information on the web. So these are all interesting problems, but in a session like this, I can't cover everything. So let me talk about the content issue, in particular the information challenge for biomedical researchers. The whole world of biology, and I know there are some bioinformaticians in the room, has been, you know, really turned upside down with all these new biotechnologies that produce massive amounts of data. The word that is commonly used is high throughput. And sort of the prototype technology is gene microarrays that a single experiment generates 10,000 data points. It measures the expression of 10,000 genes in a tissue sample, so a tissue sample of a cancer or even a normal tissue. And so it's very data intensive, and this is very different, or those of you who have ever done biology research know of, you know, the old days where you could literally write your measurements down in a lab notebook. This situation, and then you have the reason why information retrieval plays a role here is because if you do a microarray experiment and you find that there's 20, 50, 100 genes that are upregulated in the system that you're studying, and I know that these systems are, you know, there's issues with the data that comes out of them and so forth. But those issues aside, if you find there's, say, 20 genes that you previously had no clue were involved in the disease system that you studied or the animal system that you study, and now all of a sudden you have to go learn about these genes, you have to explain how they might be involved in the system that you study, you may even you may even use this information to generate new hypotheses about how this disease is caused or how this particular protein functions, et cetera. So this whole environment presents some really interesting information challenges, and many in the bioinformatics community have been looking at different aspects of this problem. everything from information extraction, data mining, text mining, and so forth. And some of my recent work that I'm going to talk about here is focused on this problem from the information retrieval perspective. And so there's many reasons to try to better structure knowledge about biological systems with genes and how they're regulated and the proteins they produce and the environmental influences and so forth. And so there have been things like development of model organism databases that try to bring together all information for a certain organism, the mouse, the fruit fly, et cetera. And another valuable part, another desirable or attractive part of this area is that almost all this information is publicly available. Most of it has been produced by research that's federally funded, and in fact researchers are required to deposit their data in public databases, which actually is not the case for things like clinical medicine, where it's very difficult to get a researcher's original data. I mean, there are some concerns about privacy and stuff like that, but there's also a difficulty in getting data. In fact, about the only thing that you can't really get to, I address as the second grand challenge, which is the journal literature. So when you're a biologist and you're trying to kind of get a handle on the knowledge in the area that you work in, you go through phases. Initially you're staring at all the literature. You have a new question, so you don't know which articles you need to read. So you need to do a literature search or information retrieval search. And you go from all literature to a collection, a set of literature that is possibly relevant to your needs. And then typically these days, by reading and going through articles, you develop your collection of things that are definitely relevant to you. And then you may, in some way, structure your knowledge, everything from the filing system you have in your cabinet or on your hard disk or whatever, or to people who are building things like these model organism databases that are trying to structure the knowledge. And a lot of work in bioinformatics has been going on in the information extraction and text mine arena after you've already gotten this collection of definitely relevant literature, but there hasn't been that much attention paid to these higher levels of going from this big, huge mass of literature to a reasonable set, and that's the space of information retrieval. That tends to be the kinds of things we focus on. Information retrieval, the goal is not to necessarily deliver the answer or the structured knowledge. The primary goal of information retrieval is to deliver information that has a good likelihood of having what they're looking for. For example, librarians don't do a real lot of mediated searches anymore, but they try to get a stack of articles that what the patron is looking for is likely to be in that stack. And so some of my work in recent years has been focusing on information retrieval in the biology, biomedical research area. Well, let me take a little detour, and you'll see how these two are connected in a moment. In addition to people like myself who do information retrieval in the biomedical world, there's also a generic information retrieval world. And actually a number of folks at this university are highly involved in that world. And a big organizing event for this field over the last 12 years or so has been something called TREC, the Text Retrieval Conference. And TREC came about because the information retrieval world that has always been very concerned about evaluation and measuring how well systems and algorithms do. In the early 90s, many of the test collections that people used were on the order of a few thousand documents and just not really representative of the real world. So with some funding from NIST, the National Institute for Standards and Technology, the TREC conference was born, started by Donna Harmon, who some in this room know, and now run by Ellen Voorhees. And so TREC is a forum for comparative evaluation of retrieval systems. In a way, it's kind of driving the field because people who are building systems, at least in the research community, want to do well with TREC data. It is a competition in the sense that different systems are compared, although the goal, the philosophy anyways, even though it doesn't always work out this way, is to kind of minimize the competition and sort of maximize the collegiality. And oftentimes that's the case, although there's a few exceptions. So TREC works on this annual cycle where test collections and queries are distributed. And most of TREC is actually focused outside of medicine, mostly with newswire data, and queries come from U.S. government information analysts who, like most governments, there's the people employed to scour the literature. And of course, it's not just the government, it's businesses and so forth, competitive intelligence or whatever it's called these days. And so these test collections, which are large, realistic size collections of documents, mostly in the case of TREC, it's newswire documents, and then queries that people, these information analysts come up with. And then it's determined which of these documents are relevant to which queries. And when the participating groups run these queries through their system, they get results, and then everyone convenes usually each November in Gaithersburg, Maryland, to present their results and discuss them and so forth. And TREC has been a real major event in the information retrieval community. TREC started, when it started, there were no, it was, in the early 90s when most people were still not really using information retrieval systems, and it focused on some major tasks, and the interest has kind of run out of steam in these, and people have gotten on to more specialized things. But ad hoc retrieval, which is basically, walking up to a search engine, doing a search and getting back results, and routing, which is important in the intelligence community, in companies, financial companies, whatever, who are tracking businesses, events, things like that, where so you already have some known relevant documents, and then you get a stream of new ones, and you can use the knowledge that you've gained from the ones that you know are already relevant. Over the year, TREC began having these tracks when certain interests emerge, and there's usually about 7 tracks in each year of TREC, and each has about a 2 to 4 year lifespan, sometimes longer. And so things like question answering, so going beyond information retrieval and actually trying to point the user to the answer to a question. Cross-language searching, particularly in Europe and other parts of the world where lots of people speaking lots of different languages, and you want to be able to issue a query and perhaps search against documents that you don't necessarily speak that language. And you may use that in a situation where, if you're in an intelligence analyst in a business where you would have to decide which documents you want to pay to have translated, the better you can do cross-language retrieval, the less money you spend. Web searching is obviously an important subset of overall information retrieval. There is also work in TREC in interactive searching. Most of TREC tends to be that kind of system-oriented evaluation without a lot of user experiments. And then a few years ago, a growing interest in moving TREC into other kinds of domains. And genomics was one that kind of emerged. In part because I've been involved in TREC, and I have this sort of biomedical lineage, and a lot of computer science people interested in bioinformatics and wanting to explore that area. So we began the genomics track of TREC. We recently completed the 2004 cycle, which was actually the second year, and the first year was kind of a preliminary year, and the results, I think over time from the first year will be less interesting, but I think some of the results that come out of the second year will be more enduring, or at least the test collections that we've built. And we've been fortunate to have gotten a grant funded from the U.S. National Science Foundation, so that is funding the building of the test collections and so forth. And if you're interested in the genomics track, it's the URL to the website. So typical to track, we created 2 tasks in the track. Everything starts with TR in track. So one of the tasks is ad hoc retrieval, but not just any kind of ad hoc retrieval. We actually tried to go out and get some real-world biological information needs. And so about a dozen or so people who were involved in the track volunteered to go out, and we created this little form, and we interviewed real biologists to try to get some real-world questions, and then we had to massage them a little bit. And then we used Medlines. So basically, we have these information needs statements, and people can search against Medline. A lot of people said, well, why don't you use full text? There's so much full text these days, and that is true, and we actually are interested in looking into full text. But in reality, Medline is how most real users of the biomedical literature enter into the literature. You do a Medline search, and then you, in this day and age, you click the link to get to the journal article at the publisher's website or wherever. And then a second task, which I'm really not going to talk about today, because just for me to explain what it was about would take about half of the time, but an idea of categorizing documents. And there's a whole sub-area of information retrieval called text categorization, where people look at categorizing documents. And this is actually quite important, not only in genomics, but also in clinical medicine, where you want to categorize documents by whether they're good sources of evidence like clinical trials or just articles about a topic and so forth. And so in the categorization task, we tried to mimic some of the real-world problems faced by curators from the mouse genome database in terms of how they choose articles and then assign terms from the gene ontology, which some of you might be familiar with. But if you're interested, the paper that I cite is the overview paper for the 2004 track, and you can get more information there. Some of you who are familiar with my work know that in some ways this is a little bit of a departure. I mean, one is that I come from a clinical background, and a lot of my earlier research focused on clinical uses of retrieval systems. And also, in recent years, have written a lot about the limitations of these recall and precision kinds of measures, and that we really need to be more focused on user evaluations. And now here I am back doing recall and precision. But some of this will actually come full circle, because first of all, in terms of the clinical thing, genomics is the future of medicine, and no one really knows how all this is going to work out, but if you listen to some people in the future, your genome will be scanned and you'll know whether you're at risk for this disease or how you'll respond to that drug and so forth. I think that some of that, at least some of that, will come to pass. And then with the user studies, we actually are looking at adding user studies and perhaps looking at other modeling other kinds of users besides biology research, things like clinicians dealing with genomics information. Another comment, and this always comes up in informatics circles, about how different bioinformatics is from medical informatics. I actually think they're cut from the same cloth, although I know not everyone agrees. But I think that my work, anyways, kind of shows that these information retrieval principles apply across these two different areas, as do a lot of other things in informatics. But I know not everyone agrees. So in the 2004 genomics track, we were actually had the largest number of participants of any of the tracks in Trek. So this attracted an audience that brought computer scientists, biologists, and so forth together, a total of 33 different research groups participating. Just to provide a little bit more information about the ad hoc retrieval task, I mentioned the documents. So we were basically able to get a subset of Medline from the National Library of Medicine, basically everything from 1994 to 2003, about 4.5 million documents, and that's about a third of the whole Medline database, which has about 13 going on 14 million documents. And it's about 9 gigabytes of text. And so in terms of real-sized information retrieval systems, that's pretty reasonable. It actually, just to show you how the world's gotten, some people had trouble FTPing it. So if you actually compress the text, I have a little DVD burner on my laptop, and so for a few groups, you know, it took me 10 minutes to burn a 2.5 gigabyte DVD and send it in the mail. You know, you couldn't do something like that 5 years ago. On the topic side, I mentioned that we got a number of people out interviewing real biologists. We developed 50 topics. That actually came from 74 information needs, from 43 different biologists, 11 reviewers, and then we kind of massaged the topics and made them searchable. So this is a typical topic. It has a title, which is sort of a short statement of the information need, and then a more detailed one, find information about da-da-da. And then there's some kind of context, which is really sort of a background statement. So people who were participating in TREC could take any or all of these different fields of the query and pump them into their systems and see how well they were able to retrieve. And you would get a recall and, well, you'd get a mean average precision level, and that would enable you to compare. So in order to determine which of these articles is relevant to a given topic, you have to do these relevance judgments, and the way that you do it in TREC is you take some top number of documents and that is retrieved from each search, and you pool them all together so you don't have judges viewing documents in duplicate. We happen to have 2 judges. One was a PhD biologist, one was an undergraduate student. For those of you who are familiar with CAPA scores, their CAPA agreement was only fair, but this is actually pretty typical for information retrieval. And so of these 50 topics, on average, they assessed about 975 Medline records for each topic, determining that 93 were definitely relevant, 73 were possibly relevant, and so when you add the 2 together, the average topic had 166 that were definitely or possibly relevant, and that's what we consider to be relevant from the standpoint of calculating recall and precision. And as you can see, there was a huge range. In fact, 3 topics had no definitely relevant documents. So the primary performance metric is this mean average precision, again, which is the average precision. It's the average of the average precisions for each of these 50 topics. And we measured some other things. Precision at 10 is a common measure because many systems show you the first 10 documents like Google does. And also precision at 100 because people who are serious searchers are usually willing to go fairly far down in the list. There's all kinds of evaluation measures. There's actually a software package called TREC-Eval that does these. And we also did statistical analysis to see if we can actually determine if there was statistical significance in the differences from these different groups. So I mentioned that there were 27 different groups who could submit up to 2 runs. So a few groups only submitted 1. So we got 47 runs, and the mean average precision, again, which isn't a number that kind of has a sort of practical meaning, but it is a way to compare systems. And as you can see here, our folks from Waterloo here actually did very well on this task, and other people did less well. The second arrow points to the value in which statistical significance is achieved from the top run. So actually you could argue that anything to the left of that is it's not statistically significant, so it could be due to chance. But anyways, as you see here, there's a variety of different, people tried a lot of different techniques, and some actually work well and some don't work well, and that's kind of the value of TREC. You have a lot of different people, different algorithms, systems working on the same collection of documents and the same topics. So what kinds of techniques actually worked, although actually it sounds like I found out this morning this may not be completely accurate. One of the challenges in Trek is that this annual cycle is probably too fast, and you don't always get the thorough, detailed analysis that you could. But it seemed to be, coming out of the Trek conference anyways, that one technique that worked well is domain-specific query expansion, meaning like going out to some of these databases of gene names and pulling in gene name synonyms and adding them to the search, pulling in other kinds of related terms. And then other kinds of generic techniques like language modeling techniques that allow you to smooth your data away from a kind of binary, either the search term is in the document or it's not in the document. At least at the time of the Trek conference seemed to be the techniques that the people who had the highest results did. One of the things that we did, we were so busy running this thing that we actually didn't have a lot of time to do research. And so we just did some kind of out-of-the-box runs to see where they would score relative to other groups. And so we used a system called Lucene, which is an open-source information retrieval system. And actually we found, we actually scored above the average, which means that a lot of people were doing detrimental things, trying to do techniques where they were pulling in terms or from other things and so forth. So we actually scored, we were somewhere, I think, in about here or so, with really just kind of pulling a standard system off the shelf and just running it. So a lot of people did things that kind of perform worse than a baseline. So again, I don't have a real lot of time talking about the categorization task. In fact, I'm not even going to go through this slide just so I can move on. But you can read more about it in the overview paper that is sitting on the website. So I wanted to finish my discussion by talking about another grand challenge that actually has very little to do with technology. And I think it kind of demonstrates that in fields like informatics, oftentimes the real important issues are not really centered on the technology. And all of us are interested in technology and using it in new and innovative ways. And then a lot of times we encounter problems that the technology isn't really the issue. So one of the challenges in medicine, is accessing the archive of science. And in many fields, like computer science, people, you get an article accepted in a journal and you stick a copy of it on your website. With medicine, that's very frowned upon by the publishers and others. Yet, a lot of that information, with all due respect to all the great things we do in informatics, I mean, a lot of the medical information is actually very important to people, and they may want to read it. It's also hard for students to get access to articles. It's hard for people in developing countries and so forth. And I think probably everyone would agree that there is value in disseminating the biomedical literature more broadly. We've actually figured out how to do electronic publishing pretty well. Most of you are familiar with Highwire Press. They've figured out a very nice way. You can get the PDFs of the articles like they look in the journal. You can search over them. You can link when there's a bibliographic citation and so forth. Highwire is a very impressive system. So there really aren't technical issues anymore in electronic publishing. There's some of the digital library issues, but the real challenges are kind of economic and political. How do we make the journal literature more accessible while recognizing, though, that there is a cost to producing good quality scientific literature? So I'm actually not arguing that we should copy these articles like my teenagers copy MP3 files. And then, you know, we also have a situation in most scientific fields, definitely in medicine, that a lot of the big journals have monopolies because in order to get promoted, you have to publish in those journals, or certainly they carry a lot of prestige on your CV if you have a paper in New England Journal of Medicine or JAMA, one of those journals. There's a bunch of other concerns about electronic publishing. One is that, I know there's some library people here, is that there's a lot of people who make decisions about budgets don't value libraries. And so when, you know, universities need to cut their budgets, you know, let's cut the library budget. At the same time, though, we have the costs of journals going up, 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 and particularly the journals that have these big monopolies. And then there's other issues, like, for example, you know, I still subscribe to a few paper journals, but I actually don't keep the issues anymore, you know, because I know I can just go to any website and get the article if I need it. But one of the downsides is if I lose a subscription for whatever reason, you know, let's say I decide to stop my subscription or my institution decides to stop the subscription, you know, my back issues are gone. I used to, at one point early on in my career, I had all my back issues of, you know, from like medical school, New England Journal of Medicine and stuff under my bed and stuff like that. And then finally I just got rid of them all. You know, there's really no need to keep back issues anymore unless you lose that, you know, unless you lose your subscription. So these are some of the publishing issues. So there's this growing call for what people call open access to scientific research results. And part of the rationale is that, you know, we pay for this research as, you know, taxpayers, and, you know, in all the major developed countries, you know, we have the NIH in the United States, and other countries have their bodies that fund health research. You know, so we pay for this research, then we have to turn around and pay for it again when we try to read about it in a journal. However, that's balanced against the fact that journals really do add value, and I think it's important to make that point, that you know, production of information is not free, and then also secondary publications that have even more synthesis involved. There's been a lot written pro and con, and there even has been some proposed legislation. It was proposed by a blue state lawmaker, so it didn't go too far, but prohibit copywriting of not only government documents, which is already prohibited, articles published by government employees, but articles published by government-funded research. But we'll see if that bill ever comes to pass. There are some open access publishing initiatives. In particular, Biomed Central and Public Library of Science have a model where you pay up front essentially the equivalent of page charges. Biomed Central, the cost is $600, and it's anticipated that you would pay that from your research grant, that you would budget for it. But once you pay that money up front, then the article is freely available to yourself and anyone else. And so, again, the idea is not that this information is just produced for free. The economic model is different in that you pay for it, and then it becomes freely available to everyone. The publisher is essentially making their money by getting paid to produce it, as opposed to actually selling the article. This is a complicated, a lot of information on this slide, but I'm almost done. The NIH has been grappling with this issue. The issue has actually kind of reached, you know, the federal level, the medical societies, the medical community, certainly in the major developed countries, US, Canada, UK. The NIH actually put out a request for information on these regulations and got 6,000 replies. Lots of people think about this topic. But the publishers, even some of the nonprofit publishers, have kind of pushed back on the pure open access idea. They argue, like, for example, the editor of the New England Journal argues that $600 may work for Biomed Central, but it costs a lot more than $600 to produce a New England Journal of Medicine article. And there's issues of financial viability. A lot of medical journals are actually revenue producers, either the subscriptions or the advertisement or whatever. There is also this issue of what about people who are from developing countries or are unfunded researchers? How can they pay these things? And then there's also concern that, about the government controlling publishing. So there was actually a compromise policy that was developed that basically would call for journals to voluntarily release their research papers after 6 to 12 months. And a number of the big medical journals have been actually doing this now. A lot of journals now after 6 months will make things freely available on their websites. The policy was withdrawn. It's believed that there are a lot of conspiracy theories behind it, but actually a new Secretary of Health and Human Services is being approved, and so it was decided probably to wait until after he's approved. So it's not clear where open access publishing is going, but clearly there's a lot of issues related to accessing. And this is also important for information retrieval researchers, because when we try to build these test collections that researchers can use for their research, it's a challenge. A lot of the publishers are not willing, and it makes it harder for researchers to build better systems, and hopefully that will change over time. It's actually gotten a little bit worse. 10 years ago, since there wasn't the internet or it wasn't as widespread, some of these publishers were more willing to give you stuff, but now they're worried it would get out on the open web and they would completely lose control over it. So just a few points in conclusion. Information retrieval systems in the last decade or so become very mainstream, so lots of people searching for health information, everyone from researchers, physicians, nurses, patients, consumers, etc. And in fact, searching is really an essential skill for knowledge workers and perhaps the rest of the world to learn more about health as they develop health problems. Basic searching is relatively simple and easy to do. And so the real challenges then remain in providing access to the appropriate information, so not just information about the topic, but the appropriate information for the task, the best information, and then also preserving somewhat of the incentive to produce it. So I mean, those who do produce information for a living can do so. So that's all I wanted to say, and I'll be happy to answer any questions. Thank you.
All right. Well, I thank you, Bill, for a wonderful presentation. I invite questions from the audience and from our web as well, webcast. So if there's people that want to send in a question from the webcast, please do so in the chat area, and I'll try to see them as they come in. So questions, anyone? Yes?
Hi. You have been working on commercial of the efficiency of a retrieval system, but how would you take into account the fact that people adapt their queries to the system? Like people querying Google will tend not to put too many keywords because they are afraid of getting an empty answer, but if the system was different, they could put more keywords, but they won't do that because they are used to Google and it takes them time to adapt. How do you take this into account, or do you see any way to take it into account?
Yeah. So the question is, people adapt how they use systems to how they're built or what their interfaces are like. That's definitely a challenge. So you may be familiar with some research that has shown that the average web query is 2.2 words, and people who do research with test collections know that queries that short are very problematic. One of the big challenges, and this is why user evaluation is so important, is that it's very easy when you're just doing system research to take a long query to find ways to make it even longer. But when you give those sorts of techniques to a real user, will they actually use them? There's been some research that actually came out of the Trek Interactive track where they made things like a technique called relevance feedback, where you say this document's relevant, that one's relevant, and then you pull new search terms out of those documents. Users didn't always want to use it, even though they knew what it did and so forth. So I think you need to find ways to motivate the users to provide more information to the system, you know, I mean, short of kind of peering into their brain and trying to get what they're thinking, which obviously we don't know how to do yet. Actually, if you look at more motivated searchers, you know, people who are really looking for things and really have a motivation to kind of find really good things, they actually are willing to invest more time. And so, you know, maybe you need different interfaces for different kinds of users. But if someone, you know, doesn't want to do anything more than type in 2.2 words, you know, there's not a whole lot to do for them. But if they are willing to provide more interaction, you know, if you can, there's systems that suggest additional terms, you know, based on documents that they know are relevant, you can actually do a lot for the user. And so the challenge becomes how to get the user to use those systems.
Just a second here. First of all, I want to say that normally Dominic Covey is here doing the role of facilitating this question and answer period. I'm the stand-in for today, not the comic stand-in, just the stand-in. And he has sent a message. We sent him far afield so that he could be our tester of the webcast. Really, it was for another reason, but he is viewing this via the webcast, and he says, "Thank you very much, Bill, for a good presentation."
I know where he is. It's a lot warmer than it is here.
and we want to thank. He wants to thank you for coming all the way here, which is much less desirable than where he is. But he does have a question for you, and that is, what is NLM doing in this area using the Metathesaurus?
Metathesaurus, yeah. Well, some of you are probably familiar with the UMLS project, Unified Medical Language System project, that the National Library of Medicine has been doing for actually almost 20 years now. The chief component of this UMLS system is the Metathesaurus, and that's essentially what, you know, there's a lot of different thesauri in healthcare, like MESH, SNOMED, ICD-9, and the Metathesaurus tends to link all these things together, so it provides a much kind of richer vocabulary. So there are some people who have done, for example, query expansion, where if someone, you know, types in a term and you somehow know that they're talking about a term that has a number of different synonyms, you know, like many diseases have more than one name, like high blood pressure, hypertension. You can add those terms into the search. And that seems to buy you a little bit of improvement in things like recall and precision, although not a substantial amount. You know, one question emerges is, you know, will we over time be able to build systems that can do this kind of metadata production on a more automated basis? And some of the research groups are looking at ways like that. And if you know many different expressions of a term, you're more likely to be able to map it from text. So the Metathesaurus hasn't had a massive amount of improvement it hasn't led to a massive amount of improvement in information retrieval systems, but there's some research emerging. I don't know if that answers his question, but
we'll see if he's satisfied with the answer. So
he can email me tomorrow.
Yeah, or I'll view it the response in a second. So if you have a question, just wait till I get there, because we'd like to record you on this presentation as well. So yes.
Other than the information retrieval as a research area or topic, is there any other topics that you're involved with, or that the biomedical informatics would look into?
Oh, yeah, sure. Yeah, there's lots of interesting research areas in biomedical informatics. One area that I don't personally do a lot of work in, although actually I give lots of talks about it because it's kind of a big area, is the whole area of electronic health records, which there's all sorts of good emerging studies about how they, enable you to reduce errors, improve the quality of care, and so forth. And then even further issue about moving clinical information, across traditional business boundaries. I always give the example of a couple years ago when I was in Beijing, I was able to stick my local bank card in and get Chinese yuan out of the bank machine. Yet, if I were to fall sick, here in your lovely city, I don't have any major medical problems, fortunately, but if I did, it would be a real challenge for the hospital here to try to get that information. And we need to move more in that direction. So that's another big research area. Patient health information access, what's the best way to provide it? How do you interact with the medical systems, electronic record, and so forth? Which information should flow back and forth? Other areas like telemedicine, image analysis, and so forth. There's a whole variety of research issues in biomedical informatics broadly.
Before Google came about, people used to put links on their web pages. Google, of course, is taking advantage of all these links. But now that Google is so successful at finding, when I talk to people, nobody really makes links anymore because they don't know, they just go to a Google search. So in some sense, Google is being self-defeating. Is Google finding a problem with this?
I'm not sure. I don't really think so, because actually, in a sense, people have more incentive to put links on their pages now, because they'll be picked up by Google and you'll be ranked higher by Google's algorithms. So I don't know that it's true that people aren't putting as many links, at least not that I'm familiar with. And I know there are, because I get email from them, consulting groups that are willing to help you, get more links to your page so you'll show up in major search engines and stuff like that. So, the Google algorithm actually works quite well for medical topics. 10 years ago, one of the other activities I do is teaching physicians how to find this kind of information, in day-to-day practice. And 10 years ago, we told them, never go onto the open web. You can't trust the information. The search engines will find, lousy garbage and stuff like that. But that's really not true anymore. I mean, the Google algorithm does actually work well because, people can game the system, but it really does tend to point to the most authoritative pages. And there's a lot of good information out there now, and you can get to it. So, I think Google's actually doing quite well, and it's actually a reasonable way to find good clinical information, like everything else. You sort of have to, look at the authority and the trustworthiness of the people who produce the page that you actually find in terms of how believable it is.
I have a question, and I'm also told that I've got to carry this mic with me as well. So my question is, though, that with Google, are they too manipulating what your eyeballs see and therefore manipulating what you retrieve?
No, Google, Google's there's several people from the information retrieval world who now work for Google, and it's actually interesting to talk to them. I mean, Google spends a lot of time, it's this kind of cat and mouse game. People figure out how to game the Google algorithm. So Google actually has an army of engineers who do nothing else other than try to kind of defeat the people who are trying to game their system. It's sort of cat and mouse thing. Google wants to be sure, part of their, even though they don't necessarily make money directly on the search results they give you, they make money on the advertising and the other kinds of things. But they want the search results to be as high quality as possible so people will think of coming back there and searching again, so your eyeballs will look at those ads and do the other things that Google does to make money.
All right. This side hasn't been represented by any questions at all. So any questions here yet? Or No, not yet. Well, then we'll go back over here.
It's interesting, when I was talking, I was actually worried that I was sort of talking too much, trying to move myself around.
I wonder if you could say something about one of the other grand challenges. If you switch from a researcher to a clinician, how does that change the problem and the solution?
Sure. Yeah, and you know, one of the reasons why the biology world has been a little more appealing is because, well, actually, let me explain the solution, then you'll sort of see why the biology world becomes a little more interesting from a research perspective. Generally, the information that clinicians need is, you know, a fact, you know, an answer to a question, and they have very little time. And that, you know, so whereas a researcher, if your whole life is, you know, some gene, you know, whatever gene I had, you know, you're willing to spend a lot of time reading about that gene. But, you know, if you're a physician, you're dealing with a myocardial infarction patient 1 minute, a diabetic patient the next, and, you know, you're moving from thing to thing. And there's actually been a fair amount of research done on the kinds of information needs that physicians have, and they tend to be specific questions in the context of their patients. They tend to, on average, have an unmet information need 2 times for every 3 patients they see. So physicians have a lot of questions and very little time to answer those questions. And so the last thing they want to see when they have a question is a journal article. You know, what they want is a paragraph or a sentence, you know, the best test to use when the patient has this symptom and you want to rule out this disease is X. Or, you know, the most common side effect of this drug is Y. And so the quantity of information for clinicians, at least at the kind of practice level, is actually not massively large. I mean, most, you know, most comprehensive medical textbooks, you know, the text is only maybe 5 or 10 megabytes. But so the real challenge to physicians is not, you know, kind of indexing and crawling over this massive information space. It's, you know, how do I get the information about this test or treatment to the physician? And there's a fairly mature industry, you know, the book publishing industry, and they have a lot of products. You know, a lot of them are web-based now. A lot of them used to be CD-ROM based and so forth. And they focus on producing those sorts of products. It's really hard to do research with those because, A, the publishers are not readily willing to kind of give you their, I mean, unless you want to kind of like buy their system, but then you can't manipulate things inside the system when you buy a commercial product. You know, you can't change the indexing algorithm or something like that. And so for that reason, it's been difficult to do kind of real good system-oriented kind of retrieval research with that information, as opposed to the biology world, you know, where you have motivated users who are willing to look through lots of documents, and with, you know, with the exception of the full text, all this other information is freely available. But those are kind of the major issues with clinicians. I guess another big issue with clinicians is what's the right way to take the context of electronic health records. So if a physician's sitting viewing a patient's record, the system actually knows about that. You know, it knows what their medical problems are. It knows what medications they're on. How can you use that information to guide the physician to information more quickly and so forth? So those are some of the research issues which are definitely interesting.
Related to that, so much of what I imagine is still very text-based retrieval. But where are we going in terms of other media type, audio, video,
Yeah.
And the searching of that and the presentation of that? Is there a way of filtering all of that into a much more precise level for a clinician to use, or whoever it might be?
Yeah, well, actually, image retrieval certainly compared to text retrieval, is in its infancy. And you know, Google, again, actually, I find myself using Google's image retrieval thing more and more, which is basically, you know, it'll find web pages, it'll show you the pictures on web pages that have the text that you type in. I think image retrieval is heating up, and I'm actually involved in a project. I mentioned this cross-language retrieval. What happens sometimes in Trek is that these tracks get so big they kind of break out of Trek and they become their own thing. And so this cross-language retrieval, it's called CLEF, C-L-E-F, which is how you pronounce it in French, Cross-Language Evaluation Forum. And it's devoted to cross-language image retrieval, cross-language information retrieval. And within that community, a group of image retrieval researchers has kind of emerged. And within that image retrieval, there's some people who are interested in retrieval of medical images. So we're actually doing the same kind of thing I talked about with kind of Trek and the other kinds of retrieval, and developing test collections based on real-world information needs that, again, will allow people to develop systems and test them. But, you know, in the future, it would be great, you know, if, you know, actually, just an example, the image I showed on my second slide, I had lost that image, and I was trying to find it in Google. You know, I was typing in red state, blue state, you know, and Canada, United States, and I couldn't find it. I finally had to, like, go through my email archive and find it there. But, you know, more and more, I think people will say, you know, I would like an image of so-and-so. I mean, there's all kinds of uses in medicine. You know, I have a patient that I think has pneumonia. Show me some other x-rays of pneumonia. Or I'm a medical educator and I want a good picture of a certain, you know, type of inflammation or cancer or something like that. So I think image retrieval is going to become more interesting, and hopefully we'll see more research and better ways to do it.
All right. Any other questions? I should go back and check the chat area to see if anybody's coming in through that way. But anybody else from the audience? Well, we do have a question here. Could you give a quick overview of the of your university's informatics education program?
Oh yeah, that's right, and that's actually listed in the abstract there. You know, another area that's of great interest to me is sort of informatics education and the development of the field, and you know, what do you actually teach people when you're trying to educate a wide audience who will be going out and either doing research or actual implementation of information systems in health and biomedical settings. We consider our program to be kind of full spectrum informatics. So we have work in bioinformatics at the cell level, medical or clinical informatics at the person level, and even a little bit of work in public health informatics at the population level. But we believe that all informatics is kind of guided by principles, and it's really that kind of intersection of people, information, and technology. So it's more than the technology, it's the people who use it and the information that they use. And really what distinguishes something like bioinformatics from medical informatics is that you use different kinds of data and maybe are doing different things with it. We have a master's degree program and a relatively new PhD program. Historically, a lot of the informatics training in the United States has been postdoctoral fellowships, so people who are already MDs or PhDs doing a fellowship, originally starting in almost like the apprentice model, but now more and more institutions are developing degree programs as a kind of knowledge base of informatics emerges that people need to master to work in the field. Another change in the informatics area, in the informatics field in recent years has been a growing number of people who are interested in what is sometimes called applied or professional informatics. So people who don't want to become an informatics researcher but actually want to just learn the best way to implement an electronic health record system or some other kind of information system in a biomedical setting. And so our curriculum has shifted a little bit to reflect the interests of those people. So not only are there courses about technology, but courses in things like organizational behavior and management, project management, technical writing, things like that. And another area that we've gotten into quite heavily in recent years is distance learning, and we kind of stumbled into this because people had asked us if we could provide some of our courses by distance. And it turns out there's a huge market for it. There's actually a lot of people out there. Some of them are physicians in practice who want to do more in informatics. More and more hospitals are hiring clinicians into part-time, like chief medical information officer or chief nursing information officer roles. And we started out by putting individual courses up, and then we developed what we call a certificate, which is, I think you guys have a diploma program, which is the same sort of thing. That's kind of a subset of a master's degree. We actually then put our whole master's degree program online, and so there's lots of interest out there in informatics education, and it's a topic of great interest to me in addition to everything I've talked about today.
Well, those of you that may not know it, Bill's program is one of the best in the continent, so you might want to give the URL for your programming at, what is it?
It's www.ohsu.edu, then /DMICE, which stands for Department of Medical Informatics and Clinical Epidemiology.
And if you didn't get that recorded?
Actually, if the handout has my own personal, billhersh.info. If you go there, you can link to it. And actually, that URL just redirects you to a page on our website. I just got so sick of giving people these long URLs that when the .info ones came out, I saw that billhersh.info was available, so I grabbed it, but I just set it up as a redirect.
Okay. Well, one last question, and then that will be it for today. Oops. Just a sec.
What biology requirement does your PhD program expect of computer science graduates?
Yeah, actually that's a good question, and let me kind of broaden the question to talk about the requirements, because this is a real challenge in this field. Informatics is a very integrative discipline, so it draws on a lot of different disciplines: computer science, medicine, biology, etc. The entry requirements are pretty minimal. We require all students in our graduate program, so master's and PhD, to have a single course in human anatomy and physiology. Now, we've actually been having discussions with a local biology department, but for people who want to do bioinformatics, whether it might be more appropriate for them to have more of like a cell and molecular biology kind of course as opposed to a human anatomy and physiology. In our program, we have some courses that focus on the biomedical research environment and the clinical medicine environment to provide more background in those areas. Plus, just in general courses on medical informatics, you pick up, like you take my course on information retrieval, I give medical examples, so you pick up pieces of medicine here and there. So the requirements are small, but we want people to demonstrate, that they have some interest and have taken some coursework in this area. Let me just flip the question too, because I often get asked this: what computer science requirements do you need? We, for our master's and PhD programs, require an introductory programming course in one of the modern languages. We prefer C, C++, or Java. We'll look at other ones if people have them. And then we have a computer science curriculum, which in essence is kind of like our introduction to medicine for non-medical people. It has a little bit of programming. It also covers databases and networks more at a higher level. So, I mean, the database stuff focuses more on things like SQL and information models rather than record locking and things like that. And the goal is not to create programmers, but the goal is to create people who can be conversant with programmers and you know, have a foundation of the technology and being able to learn new networking acronyms as they become available and so forth. And likewise, you know, the goal of our medicine and biology sequence is not to produce doctors and biomedical researchers, but to give people who don't have backgrounds in those areas an understanding. So the requirements are pretty minimal. I mean, a lot of people come, you know, over half of our entering students are actually physicians, but people come from many other backgrounds too, so it's you don't have to be a certain thing.
We had the good fortune of going to the University of Buffalo, where we did see or talk to people at the School of Informatics, and there are several departments underneath that school. I guess I understand that there are a couple of schools of informatics in the United States.
Yeah, at Buffalo and Indiana University, and that notion is actually very appealing to me because, again, I consider my kind of core discipline to be informatics, and then because of my medical background and knowledge, I apply it in medical or biomedical informatics. But the core principles are the same. It's that kind of intersection of people, information, and technology.
Well, with that, I'd like to thank Bill once again for coming to speak to us today. Dominic sends one last message, and he said that he found it terribly frustrating not to be able to bug you verbally. So.
Which he always does.
So.
And I bug him back.
All right. So thank you, and I look forward to you coming.
Thanks.
And I look forward to seeing you all next month. So see you then.